Long COVID includes these 12 symptoms. New study finds 12 of the most common long COVID symptoms identified in long-awaited new report. A long-awaited study that zeroes in on the most common groups of symptoms for people with long COVID may not bring the relief millions of Americans and doctors have been wanting. The study, some of the first research from the National Institutes of Health's billion-dollar Recover program, does not provide a standardized definition of the condition. Researchers say it is a first step in identifying common language for scientists working toward treatments for the condition. I think that the amount of science that's going to come after this is going to be an avalanche, said study author Dr. Leora Horwitz, a professor of population health and medicine at New York University Grossman School of Medicine, as well as the director of the Center for Healthcare Innovation and Delivery Science at NYU Langone Health. The new study, published Thursday in the Journal of the American Medical Association, looked at data from 9,764 adults in the Recover trial, which has been recruiting participants since last year. The vast majority, 8,646 people, had previously been diagnosed with COVID, while hundreds of symptoms possibly associated with long COVID have long been reported, mostly through anecdotes from patients. The new study hones in on 12 of the most common long COVID symptoms include ongoing fatigue, brain fog, dizziness, thirst, cough, chest pain, heart palpitations, abnormal movements, upset stomach, lack of sexual desire, loss of smell or taste, feeling sick or overly exhausted after physical activity, also known as post-exertional malaise. The aim of the paper is not to limit the definition of long COVID to these 12 symptoms only. It's meant to focus future research into those symptoms as scientists work to figure out how long COVID affects the body in so many different ways. It also includes a scoring system that can be tailored to each patient based on the severity of their symptoms. This is a tool that can be used to identify people with long COVID for the purpose of doing more research, said Andrea Fowlkes, the principal investigator of the Recover Data Resource Corps, as well as the director of biostatistics at Massachusetts General Hospital, which is part of the Mass General Brigham Hospital system. The significance of that is that we can then begin to unravel the mechanisms for each of those different manifestations. And then, of course, ultimately, the goal is to identify treatments, Fowlkes said, but the paper, anxiously anticipated by people who still have long COVID symptoms and the physicians who treat them, has raised some criticism. I think people will be underwhelmed by a landmark paper that is describing the presence of symptoms that people have long known are a problem, said Jim Jackson, the director of Behavioral Health, ICU Recovery Center at Vanderbilt University Medical Center in Nashville, Tennessee, and author of Clearing the Fog, From Surviving to Thriving with Long COVID, a Practical Guide. This isn't a paper that offers any solutions, that offers any therapeutics. And that's desperately what people want, hope in the form of treatments, Jackson said. What is brain fog? There needs to be more specificity with describing the symptoms, Jackson said, taking issue with the vagueness of the term brain fog. What exactly does brain fog mean? If we call it a brain injury, then there's a treatment path. We know how to treat brain injuries, Jackson said. We do cognitive rehab. If we call it brain fog, what on earth do you do with that? Horwitz added some clarity during an interview. Brain fog, in these cases, includes having to read something several times to understand it, having trouble keeping appointments that aren't part of a weekly routine, and difficulty following complex directions. Another term, abnormal movements, was also vague.